Thank you for watching ADBN News at 7. Akwa Ibom State House of Assembly is called on state executive arm to prioritize the effective implementation of existing legislation to combat spread of HIV/AIDS and improving healthcare access for affected individuals in the state. Chairman, House of Assembly Committee on Health, Honourable Moses Essien, made the call in Uyo during the inauguration of the state's HIV Domestic Resource Mobilization Committee, organized by the Akwa Ibom State Agency for Control of AIDS in partnership with USAID Local Health System Sustainability Project. Honourable Essien highlighted urgent need to activate and fund key HIV/AIDS policies, which he believes will increase testing, awareness, and treatment accessibility.
And many other places, and so we need to protect these kind of persons living with this virus, and because where you deny them any of their rights as given to them by the law, and they have the opportunity to take such institutions to court.
State Commissioner for Health, Professor Augustine Umor, represented by State Director of Public Health, Dr. Etop Antia, urged committee to collaborate with implementing partners in strengthening capacity and to ensure total eradication of HIV/AIDS by 2030.
The aim of this domestic resource mobilization primarily is to fill the gap, as all the speakers before now, the very erudite speakers, and I don't want to repeat what most of them have said, but we have a target that by 2030, we should have 0 infections, that's HIV infections, 0 transmission, and 0 deaths. Transmission and 0 deaths. That is only possible if we have the finances, to support the programs that will help us to end the scourge of HIV, not only in Akwa Ibom, but in the Federation.
Other stakeholders at the event, including the Chairman, Association of Private Medical Practitioners in the state, Dr. Emmanuel Akpanabong, Zonal Coordinator, National Agency for Control of AIDS, Dr. Nnamso Thomas, State Lead of the Excellence Community Education Welfare Scheme, Dr. Bala Ghana, and consultant USAID Local Health System Sustainability Project, Mr. Ina Sunday, advocated for increased funding for AIDS prevention projects.
And so they request, they plead that we should bring up the consciousness that we look inward to generate resources to support programs like this. It's something we much encourage.
Family life and health education, community engagement, and some other areas. So there is need for us to mobilize resources in country, to support the HIV response. As it stands today, we all know that it's majorly, donor-driven program, and that is not sustainable. We all know this is not sustainable. So we need to start looking inward.
We need to truly look inwards and get the needed resources to manage HIV care, because we know that we are strongly dependent on international funding currently to manage HIV care.
We need to start supporting ourselves in terms of domestic funding so that we can be able to support our vulnerable group of people in the society. I am here basically to work with my fellow partners. I'm so excited to see a lot of partners here with me.
Program Manager, Akwa Ibom State Agency for the Control of AIDS, Dr. Enobong Akpan, enumerated objectives of the committee, including mobilization and expansion of resources at all levels to reduce HIV program dependence.
Providing us with enabling environment and support to ensure a HIV-free Akwa Ibom state. Nigeria has the second largest HIV-positive population in the world and relies mostly on external donors for its HIV control. Akwa Ibom State is one of the states contributing very significantly high numbers to the national population. Ending AIDS as a public health threat will require increased and sustained domestic funding.
Chairman of the committee, Honourable Moses Essien, in his response expressed confidence on the caliber of personalities in the committee and pledged to liaise with relevant authorities towards enhancing zero tolerance of HIV infection in the state.
Oftentimes people completely underestimate the extent of the scourge. And maybe because it is an area people don't like to publicly talk about. But I do know that even in my days as member of the House of Assembly, I used to engage my constituents that were living with HIV and had constant meetings with them. We must talk about it. And I used to say then, and I still say now, we must give a face to the struggle and the fight against HIV. More important persons, more people of interest in the community must speak about it. That is the only way we can drive this message, because there's a lot of recklessness. There's a lot of people just think it's a story up till now, after over 30-something years.
And now to reports from the Niger Delta. Niger Delta